EVA sat down with Karen Greenrose, president of the American Association of PPOs, to talk about healthcare reform. First, we asked her for her opinion on whether or not a bill will be passed this year.
Well, I think because we have no idea what that bill would look like at this point, that I'm open-minded. I think that the administration should be applauded for continuing to bring stakeholders together to discuss ideas, and right now that's just what we're hearing, are a lot of ideas spinning around. But I think the positive ideas are that we are certainly, for the first time, having very responsible discussions about all Americans having health care coverage. So that's encouraging. I think as long as we're looking at how can we expand the current employer market-based system, I think that's very positive, because one of the things that the employer-based system has done very well is it has developed a lot of tools for employees, depending on whether you're a national employee or regional level, but we're seeing a lot of those tools actually being utilized by all size employers, where it is helping the employees make informed decisions about what types of services they access. And I think that's so important, because they're learning the cost of health care. It's just not necessarily that $10, $20, $25 copay. Perhaps some of the services that are nice to have but are not necessarily medically necessary, they may say, well, you know, we don't need to do that right now.
Sure.
And so I think that's beneficial. So it's very important from our perspective as the PPO industry to make sure that any type of health care reform is based on the current employer-based system.
Next, we asked Karen if there were any healthcare reform proposals that would cause the AAPPO to just say no.
And so, for example, not that it's being discussed now, but there was the Wyden bill out there.
Mm-hmm.
That is something that we could have never supported or would not have supported.
What's specific in there? What would
well,
you say?
basically, the Wyden bill did away with the employer-based healthcare system, so there was no way that we're going to support that. I don't think that there's the recognition out there when you talk about anything that would do away with the employer-based system. As I discussed earlier, I don't think there's a recognition for the amount of education that is done there. I think it's viewed as communication, that the employer hands out, here's your benefits, this is how they work. But what the employer community has learned and has done well over the last several years is they have learned the more tools that they give their employees and the more education around how those benefits can be used, it really brings back savings and it helps educate their employees. And I think that everyone needs to recognize that that is a huge piece of bringing down costs long term. For example, we just introduced this year our consumer-driven healthcare survey. And PPOs is, 99% of PPOs are used as a delivery system for consumer-driven healthcare plans. And just in 2008, they grew to something like 44% growth in 2008, and that's because the consumers are really becoming, they want to be involved. The more sophisticated that they become about healthcare, they want to be involved in their own healthcare delivery. In the consumer-driven healthcare plans, the HSAs, the other types, the HRAs, those types of plans allow them to do that and actually put their money with the employer money to be utilized for healthcare. And so that's very positive. Those are very good programs that educate consumers, and the more we can educate consumers, that's where you're going to see significant savings in how to access and use medical services that benefit them.
Next, we asked Karen what's missing from the debate.
Well, one of the things, if we're looking at the current economy and we're looking at how can we expand the current healthcare safety net to really help reduce costs, I think that we haven't had a malpractice discussion about malpractice reform. Where that may not be a very popular discussion, I think that CMS has basically looked at never events as this approach to not paying facilities for incorrect care or infections or something that you develop when you're in a hospital setting. I think that we need to expand and look at malpractice reform. If doctors are expected to provide care, continually provide care for a lesser reimbursement, then we have to also support our doctors and new doctors entering the workforce in being able to afford malpractice insurance. And it certainly is a large cost factor in healthcare, and unfortunately I have not seen that discussed at all in the debate. And I think this, if we're talking about sincerely, we're looking at everything we can do to reduce cost. I think it's like the elephant in the room that no one's talking about.
Finally, we asked about what's new in the PPO marketplace.
Coordination of care. Certainly there are more prevention type products. We have really worked a lot with PPOs and actually supported some initiatives around chronic diseases, and really through education and coordination of care, what a difference that can mean in the quality of improving that patient's wellness during a chronic episode of any type, whether that be something like they're trying to manage on a day-to-day basis with diabetes, or perhaps heart problems, or just, you know, the overall education and coordination of care. I will say that that is one thing that is so important as we look at healthcare reform, and that's the standardization of reporting across both the private sector and the public sector. The administration in the stimulus package allowed for $19 billion to be used for health IT. And I think it's very important, if we are going to get to the point to where we can really look at saving dollars in healthcare reform, we have to have an employee health record or a medical health record. And basically, I think that's the foundation of the exchange of healthcare information. And if we can get that developed, and I think that that is something that can be done, and that the different stakeholders out there can really be helpful to the public sector in getting that done. If the government would set the standards for a medical health record, employee health record, regardless of what you want to call it, just like they set the standards for HIPAA. We need to quit this. Who should do it? It should definitely be done on the public side by the federal government, just like they set the standards, and then bring the provider community in to say what data sets should be included. Then I think you can give it to the healthcare industry, the payers, the networks to implement. I think our industry is ready for that. It not only allows for the foundation of exchange of information, but then we have finally done something to start really bringing the providers into health IT.